and then we can get started shortly after. We are down to one host. It looks like Casey is here, which is fantastic. Hi, Casey.
Hey, good
Um,
morning.
Hi, good morning. Yeah, and Caitlin had to bow out. I lost her voice, unfortunately. So yeah, but we've got Casey. Just a couple more minutes, and then we'll get started. Do a little introduction for everyone, so we're not just going in blind. All right, let's do a little introduction here, so everyone we can get started. Casey, please feel free to correct me if I get any of this wrong. But first, I would like to acknowledge that TV Vets is situated and operates on the unceded traditional territories of Musqueam, Squamish, and Tsleil-Waututh nations. Uh, On to Casey. So Casey, uh, and can you correct me if I get this wrong? But Neathway?
That's correct. You got it.
Neathway, yes. Nice to meet you. Is a seasoned public health leader and advocate for climate resilience and environmental determinants of health. He does serve as the Director of Regional Health Emergency Management in the First Nations Health Authority's Interior Region. And Casey works to support Indigenous communities in addressing the complex health challenges posed by climate change and environmental emergencies. Alongside that, Casey is also a certified public health inspector with an educational background in environmental microbiology, public health, and climate communications. Um, Further to that, Casey's expertise spans health emergency management, disaster risk reduction, and the intersection of air quality and public health, which is essential to all of this programming. Um, uh, Further to that, with a focus in collaborative and community-driven approaches, which is something we're very adamant about exploring communities as they continue to be very broad and apply to both of our organizations. Um, and just a little bit more on Casey. His work does emphasize the critical role of public health professionals in building resilient communities through partnerships, innovation, and culturally safe practices, which is essential to how the FNHA operates. And then over to you, Casey, if you're ready.
I am. Thanks so much, Mark. I just need to request sharing here.
Yes.
So yes, thank you for the introduction. I'll keep kind of chatting while that's being set up. So as Mark shared, I have the privilege of serving First Nations Health Authority in the interior region. So FNHA is operationalized throughout 5 regions, and I am in the interior region. Just hitting the share. Oh, host is not allowing sharing. Okay, I'll keep talking while that gets started. And so my co-presenter today was intended to be Caitlin Buxton Carr, who serves as FNHA's Manager of Health Emergency Management with our provincial team. Unfortunately, Caitlin came down with an illness yesterday and has no voice, so was unable to present. But wanted to make sure that gave her due credit. The presentation I'm going to be sharing today is a bit of an adaptation from one that she and I had presented at a wildfire resiliency conference in Penticton, and is really outlining the approaches that FNHA takes in supporting air quality and health with the First Nations that we serve. Okay, I'm just going to hit the share button and see if that's...
Yeah, I might have to switch the co-host here. I'm just gonna
Oh,
try
no
this.
worries.
Okay. There we go. Should work now.
Beautiful. Yep, works perfect. All right. I'm going to share this screen. And away we go. So a little bit about First Nations Health Authority for those who might not be familiar. So FNHA came into existence in terms of our service delivery options in October 2023, and there's about a decade of work beforehand to really get to that state of readiness. First Nations Health Authority is the first and only province-wide Indigenous-led health authority of its type anywhere in Canada. And we took over the delivery of services that had previously set with Health Canada's First Nations Inuit Health Branch, now part of Indigenous Services Canada, in October of 2023. So what that allowed is for transformation of how those health services were delivered. So we operate under 7 shared directives between the First Nations Health Authority, the First Nations Health Council, which is our governance or leadership arm, and then the First Nations Health Directors Association, who are the individuals who work at that community level in terms of program delivery and service expertise. And the first of those shared directives is for us to be community driven and nation based in the work that we're doing. So if you think of the transfer of services from Health Canada to First Nations Health Authority in 2023, and then throughout the subsequent 13 years, we've been undergoing transformation of those services in alignment with those 7 directives to make sure that the programming we're offering is responsive to the needs of First Nations communities. And certainly what I'll be discussing here in terms of our air quality approaches are driven by those community priorities and are relatively unique across Canada in terms of the comprehensive approach that we're taking in this space. Our first real exposure into the emergency management world, or health emergency management, was during the 2017 floods and wildfires, so about 4 years after transfer of FNHA. We had one emergency management position organizationally at that time, who was based in Vancouver, and really 2017 was the kickoff. And I don't know if you folks remember 2017, but it was I like to refer to it as our first worst wildfire season in BC. Kind of set all sorts of records in terms of wildfire number and hectares burned and certainly smoke, but was also preceded by a really heavy flood season. So we had a heavy snowpack, really hot kind of April, May, which led to a lot of runoff and flooding, which then, of course, because everything melted early, dried out, which led to a bad wildfire season. So that was kind of the impetus and the kickoff for FNHA's work in this space, and really where a lot of our air quality work began as well. So today I'm going to chat a little bit about FNHA's role in emergency management, not only in how we support First Nations communities, but how we're integrated into the broader provincial health emergency management system with partner agencies, talk broadly about strategies to identify and mitigate air quality risks, so not only ones that would be beneficial to First Nations communities that we support, but tools that really any individual can take and apply to their own learnings. And then talk about some of those community-driven approaches to improving air quality that FNHA has implemented since 2017. So we are seeing, like I said, 2017 was kind of our first worst wildfire season. And subsequent to that, we had 2018, 2021, 2023. and are continuing to see an increasing number and intensity of wildfires year over year. So I think we've had 3 or 4 worst ever wildfire seasons since 2017. This is, of course, being exacerbated by a warming and changing climate. We're seeing that even looking at the snowpack that just came out a couple of weeks ago. In some areas of the interior where I sit, we're at 16% of normal snowpack. So talking about multiple year continuous drought, forest fuels that are just tinder dry, and just ripe for these continued wildfires. Um, First Nations are disproportionately impacted by those wildfires, both in terms of location as well as in terms of the impacts to traditional foods and territories, access to medicines, animals' traditional protein sources. And so we're also seeing increased impacts of poor air quality to the communities that we support. And some of those impacts include the acute respiratory things, your irritating eyes, a runny nose, coughing, those things that you feel when it's kind of really smoky out. And then also the exacerbation of existing conditions like COPD or asthma. And there's also risks, of course, to unborn children and infants, elders, people with who are experiencing other respiratory illnesses. So that's really our impetus to act in this space of air quality. So knowing that there's kind of a pretty significant health impact of those events. Our approach in FNHA's Health Emergency Management Program, and I'll talk a little bit about the specifics, but this is our broad province-wide approach, building from those learnings in 2017, 18, and subsequent wildfire seasons. Of course, the first one is to be driven by that first directive that we have to be community driven and nation based. We have engagement tables, both formal and informal. I call it capital E engagement and lowercase e engagement that really guide the direction on how each of the regions approaches this work and how we support the communities within the geography where we have the opportunity to serve. We have formal relationships with partner organizations, including Emergency Management and Climate Readiness, the First Nations Emergency Services Society, BCCDC, our regional health authority partners, to make sure that there's those connections between the work that our partners lead and have mandate for and the work that FNHA support as well. So rather than trying to duplicate service delivery for communities that have primarily First Nations individuals or on reserve communities and those that are supported by the province, we like to create continuity to make sure that there's a no wrong door approach. And then making sure that we have an iterative approach to those operationalization of our programs. So we do lesson learned and after action reports after each season, and really make sure that those after action reports integrate the voices of the nations and populations that we serve to make sure that our service delivery of improvements are guided by the lessons that we learned year over year. So making sure that we're checking back in with communities as we both advance new programs, but also develop our existing ones as well. So this chart here is specific to the interior region. I would say is relatively similar across all regions in BC to give a bit of an overarching idea of our health emergency management supports. So systems navigation, knowing that when you are evacuated during an emergency, it is a brand new set of bureaucracy and paperwork and forms that people are really not familiar with. And thankfully, because the only time you interact with those systems is during evacuations and emergencies. So our staff support on the ground with navigating through those systems. And then kind of created across the top on that form is the cultural safety aspect of that. So starting in 2017, we really identified that there is some embedded biases and anti-Indigenous racism built into some of the questionnaires and things. So we've been able to, again, take iterative approaches to making sure that those systems are meeting people where they're at and supporting evacuees, regardless of which community they come from. We then have environmental public health services teams who support with drinking water assessments, both during emergencies and then as folks are looking to repatriate back home, making sure that they have safe drinking water. And that's linked to the rapid damage assessment of homes, of community infrastructure, and whether that's community buildings or on-site sewerage systems, drinking water supply systems, really making sure that our environmental public health specialists are first into community to make sure that when people are returning home, they're doing so to safe environments. Linked to that is our food safety inspections. Again, both for evacuees, you get a lot of donated food during evacuation, so making sure that people aren't getting sick from food that might not be prepared properly. And then again, as part of repatriation, both in terms of the kind of Western food supply, as well as access to traditional foods and impact to animals from emergencies. Traditional wellness and clinical services, so both highlighting that kind of two-eyed seeing approach to linking evacuees to nation-led traditional wellness supports, and then also making sure we have those connections with our regional health authority partners for continuity of care for individuals who might need home care support as they're evacuated, making sure that people have access to pharmaceutical products or whatever those healthcare needs are. We also know that mental health and wellness is really a big impact during emergencies. So making sure that folks who might be experiencing that trauma, and that could be evacuees who are acutely impacted by those traumatic experiences, or it could be people who are triggered by previous emergencies. And when you start to see smoky skies, that can start to reignite some feelings of anxiety and worry and distress in individuals. So knowing that we have those linkages to cultural appropriate mental health and wellness supports is really important across all phases of emergency management. And then I've kind of left the air quality piece to last in discussing this because that's the topic that's most germane to today's webinar. But looking at the provision of our air quality monitoring and mitigation supports, we have portable air cleaners, we have access to cleaner airspaces, and of course I'll talk more through that as we get through the deck. So when we're looking at how we identify what supports are needed during a response specific to air quality, what's really become evident to us since 2017 is the differentiation between quality data to allow us to act in a way that's responsive to needs and the availability of broad spectrum data. So when you look at the AQHI, the Air Quality Health Index, when you look at provincial government or federal government sites around air quality, those are based on federal or provincial air quality monitoring sites that are kind of scattered throughout the province. Those are fantastic for folks who live kind of in close proximity to those. They're mostly in more urban centers, in cities where you might expect them to be located in government buildings. So if you live in one of those centers or even within 50, 60 kilometers from one of those centers, those are fantastic sources of data. But what we found starting in 2017 was that most of the nations we serve, a lot of the First Nations we serve aren't located geographically close to any of those air quality monitoring sites. So when information was coming out, through the media, through provincial government sites on what air quality looked like, whether that was good or bad, that wasn't reflective of what folks were seeing in their communities. And then the linkage to that, of course, is that the distance of those centers means that the air quality health information coming out, again, from our regional health authority partners, from the BC CDC, isn't necessarily relevant to the individuals living in those First Nations communities. And that could be for better or like for better air quality or for worse. So if you hear that the air quality is really terrible, you need to stay inside, you need to avoid exerting yourself, but it's actually fine outside, that's not really contributing to your wellness. And inversely, if you're hearing on the media that the air quality is fine and go out and live your life, but actually there's high levels of particulate matter, that's also causing negative health impacts. So we did some research and looked at best practices kind of around the world, and really nailed down that the availability of small scale air quality monitors can improve local response to smoky skies events. These are relatively inexpensive. They're under a couple $100. They're small. They're easy to install. We are using at FNHA purple air monitors. There's also air quality eggs. There's three or four of them that use kind of similar quality of sensors. And what these have allowed us to do is invest in local data collection in a way that supports First Nations and having access to information that's relevant to them. So it's really ultra local. It looks at a few meters squared around the sensor. Usually they're posted up on the outside of a health building or an admin building somewhere in a First Nations community, and that lets you know the particulate matter, the temperature, the humidity. They've got a couple of sensors in them, and anyone from the community can access that information. So that allows people to look at what the air quality is doing directly in their home community. The nice thing about these is they work over a shared network. There's a map, if you go to purpleair.com, of all of the sensors. So the more of these you have available, the better you get a sense of what the air quality landscape looks like in that geography. So this is something that anyone can go onto the Purple Air website and buy. Again, they're $150 or something. Put up in your house. They have both indoor and outdoor ones. And then that starts to create this community science initiative of having air quality information readily available in areas where you might not have the large scale provincial or federal sensors. So then we know what the air quality is. How are we responding to those smoky skies events? Since 2017, FNHA has provided portable air cleaners. You might also hear them called HEPA filters or air purifiers to individuals who are most vulnerable to wildfire smoke. And so that's individuals, again, with COPD, with asthma, pregnant people, infants, elders, people with respiratory diseases. So really highlighting that needs-based approach. We usually have 100 or so of these every year that we're able to distribute out. So not enough where we can hook in with every individual who might want one or need one, but certainly enough where we can mitigate the worst health impacts on individuals who need these the most. That's been a very effective program over the past, it's been 9 years since 2017. We've probably distributed a few thousand of these throughout the province. And then, of course, these portable air cleaners last for a long time if you keep replacing the filters. So where we've been able, we will provide replacement air filters for those ones. And I say where we've been able because we've had some hiccups over the past procurement processes where we'll buy a few hundred of a model or a type of portable air cleaner, and then the company will go out of business or they'll stop making filters for it. And so unfortunately for a lot of those, they become really useless after a couple of years. Like once the filters are used up, you can't buy replacements. So that's been a bit of a challenge, but this is a program that we'll continue to distribute in years to come. In 2024, we started a pilot project in the interior region specifically about providing N95 respirators to individuals who both have those vulnerabilities, as noted previously, COPD, asthma, pregnant people, and also who are precariously housed. So recognizing that there's a cohort of the population who don't have access to a house, a room where they can set up a portable air cleaner overnight, looking at what the mitigation efforts could be to support individuals, again, who might be underhoused, precariously housed, who might be spending more time outside. And so we have stocks of N95 respirators that are distributed through each nation. So each community, each nation know their population and how to best get that out to them. And what we do is just provide the bulks of the N95 respirators to those folks. And then starting a couple of years ago now, we have really been pushing the incredibly beneficial SFU Breathe DIY air cleaner project. Hopefully some folks have seen about this on social media or throughout the news. This is a really fantastic project that was actually started about 10 years ago in Puget Sound, and then BCCBC did a bunch of research on the efficacy, and then SFU has taken the science experience of the DIY air cleaners that was developed through that process, and created a community engagement approach for how to deliver courses on how to build these, which is one that FNHA has partnered with SFU on and has delivered dozens of these DIY air cleaner workshops. And you might have seen these in your communities, in municipalities. This has really been a fantastic approach. And not only giving people opportunities to be hands-on with building their own air cleaners that work just as effectively as the portable air cleaners that we're distributing. So science has shown these are, again, equally effective at arresting that particulate matter as a HEPA filter that you might have, but also gives an opportunity to talk to folks about air quality and why it's important and the negative health impacts of poor air quality. So again, we've really been emphasizing this program as beneficial as it is because it adds in that knowledge translation piece alongside the air quality mitigation piece. And so alongside the portable air cleaner program that FNHA operates, we will also continue to be doing these DIY air cleaner workshops in partnership with Nations. So Nations hosts them, our staff show up and provide that expertise and the knowledge translation, and folks get to go home with an air cleaner. Continuing on in that knowledge translation thread, we're working with First Nations on how to really support community-led air quality advisory. So I talked a little bit about the Air Quality Health Index that looks at a few different factors, including particulate matter and smoke, and then provides a 1 to 10, should I go outside or not indicator. Because, as mentioned, that AQHI is based on those provincial and federal sensors, we're looking at how to support nations in developing their own health information based on the data that's now available through those purple air monitors or through data that's collected and held by the nations themselves. We want to make sure that that messaging is consistent. So we want to make sure that all AQHIs are considered equal and created equal, just to make sure that both responses and the triggers for those responses are equitable across every community, kind of every population in the province. We do an annual amplification of FNHA's air quality resources and information every wildfire season. Our comms team will put this on our website and out through social media. And then we'll also share it out kind of through our direct community links just to remind people wildfire smoke season is coming. When it gets smoky, here's how to mitigate the impacts. Here's how to prepare. Here's how to get ready for it. And then talked a little bit about how those DIY air cleaner workshops provide that opportunity to have those conversations with people while they're making their own air cleaner. So when you talk about how to best engage with people, how to share information, getting them together in a room with a hands-on approach where they take away a really effective tool is just a great way to really explain why this is important. So how do we measure success and what does success look like? It's really difficult to measure people who are not impacted by smoky skies, and this is really a challenge with a lot of environmental public health indicators. Is you can't measure the lives saved, the people who don't get sick, the people who are not impacted by wildfire smoke, and so we really have to look at how our actions are hopefully leading to those improved outcomes. So we can certainly track improved access for populations to improved air quality or to mitigated air quality impacts. We can look at the amount of equipment that we're putting out. So again, we've shared out thousands of portable air cleaners and filters over the past decade or so. During 2024, which is kind of the most recent data that we have available, we had over 280 portable air cleaners distributed, and then another 150 replacement filters, 6 boxes, and each box is 100 masks of N95 respirators shared out, and then an additional 15 plus purple air sensors installed. So we would love to see some measurable impact, and whether that's looking at people who are dispensed salbutamol or other asthma medication, whether that's looking at presentation to hospitals for respiratory impacts, but also recognizing that both the population cohort we're looking at is such a small subset, and then also looking at that all folks who are impacted by wildfire smoke events might not be presenting in that kind of clinical or medical realm. Really, what we're focused on is that upstream approach at looking at our impact, and that's how we're measuring success. So then kind of linking this to big picture, and not just the acute, the wildfire smoke, the air quality, but what the holistic implications of all of this are. So the left-hand diagram there is the First Nations perspective on wellness, and that's really foundational to the work that we do at FNHA, highlighting that the health of each individual human, the little nucleus in the middle of that circle, is intrinsically linked to the health of the land, the environment, the connections to their community and culture. And so knowing that, yes, there's the physical health impacts of wildfire smoke events, but there's also the psychosocial or the mental health impacts. That wildfire smoke is really an indicator of a change in climate and of the climate emergencies that, again, are disproportionately impacting the First Nations communities that we serve. And then looking at those compounding traumas that really underscore how important these mitigation activities are. And so not just the compounding emergency year over year. And so when you look at a community like Lytton First Nation as an example of every year there is a wildfire that impacts that community. And certainly the 2021 wildfire, which really impacted severely the infrastructure and really wiped out the village, was the big one that people remember. But there's also significant wildfires in 2017, 18, 19, and even last year we had some small evacuations inland from wildfires. So when you look at that cumulatively as a community that is recovering from multiple events year over year, and then overlay that with the additional types of crises that communities face, and that can be impact to fish sources. So we've had landslides, we've had rising water temperatures in the Fraser River, we've had train derailments. There's all of these impacts that start to build up as an overall effect to human health and wellness that can't be looked at in isolation of each kind of individual singular wildfire season. That's why all this mitigation work is important, not just to protect the health of the individual in that one singular year, but also to look at this as a more cohesive and holistic approach to what human health is. So some of the challenges that we faced and that we're looking to overcome in future years and our direction as we move forward, that continued need for increased access to ultra-local data. And so even when we look at the distribution of the portable air cleaners, I'll use Lytton again as an example, where there's, I think, 57 different reserve lands or communities within Lytton First Nation. So, if we provide one portable air cleaner at the band office at the health center, say, that isn't helpful to the people who live on the other side of the river, 30 kilometers up the road, where they're going to have a completely different kind of geography. So making sure that we're continuing to increase community access to that data. Looking at the impacts of wood burning appliances. So we focus a lot on wildfire smoke season because that's, again, the most acute. People sense that more. But for, I'm going to say, the strong majority of rural communities, and both First Nations communities and non-First Nations communities, people use wood fire as a primary heating source. And so knowing that, yes, it would be great to move people to heat pumps. There's all sorts of reasons why that's probably not going to be a panacea in my lifetime. How are we also acknowledging the impacts on air quality of wood fire smoke, those wood heating appliances, and making sure that people are equally aware of the impact that has on their health, not just July, August wildfire season? Sustainability of our portable air cleaner distribution. We had the benefit a few years ago now of Instant Brands providing us a few thousand portable air cleaners that we were able to distribute out. So that was a grant to FNHA, which we distributed to communities. Those were some of the ones where you can't get filters for them anymore because the company went bankrupt. But looking at just making sure that we have available budget for that program to continue. And that's where it's really important for us to focus focus our approach on making sure that we are making those available to the individuals who are most vulnerable and who need those the most. And that links in with the maintenance and filter replacements for those units. So once we're out in community, making sure that they're still being effective year over year, and that can be a continued benefit, not just the one-off when they're provided. And then the increase in broad accessibility of tools. So how can we make sure an equity lens is applied to this work, where each individual, regardless of what community they live in, how rural, how remote it is, has access to the same information, mitigation opportunities, and knowledge as their neighbors in more urban settings. So just to kind of sum up what I shared here today, so certainly we have seen that wildfire smoke and poor air quality can disproportionately affect First Nations communities, and that a lack of local data on air quality can impede the implementation of those mitigation efforts that we've talked about. The wildfire smoke events have, yes, physical health implications, but also mental health and psychosocial implications that need to be equally considered when we're looking at how to support communities through wildfire smoke seasons. FNHA has taken approaches to community-owned data generation and data access, as well as mitigation strategies that really meet each individual First Nation where they are, each community where they are. And knowing that we need to keep this going, we need to maintain it, and it needs to be sustainable. And to make that happen, we're going to need to keep resourcing it year over year. And knowing that, again, with the changing climate, we're going to see more intense wildfires. And so the status quo year over year approaches may not be effective over the long term. So I'll stop there and throw it back to you, Mark.
Excellent. That was a wealth of knowledge. Thank you so much, Casey. Um, yeah, I guess we can open it up to questions. If anyone has questions, feel free to either unmute yourself, put it in the chat, or you can use the reactions and put your hand up, whichever you prefer. Yeah. And if not, I have some questions. Just give people a moment.
I have a question once I get my camera right. You mentioned that it's taken a long time for merit to get reestablished. So do you have an update on that? What's really happened there now? When I used to drive up to 100 Mile, it was vacant for years, but I think there's a few buildings going on now.
In Lytton, do you mean? Sorry?
Lytton, yeah. Sorry.
Yeah. Yeah. So I can't speak for the village of Lytton and what process is happening there. But will share that Lytton First Nation has been doing a lot of fantastic work around recovery. And so they have rebuilt a lot of their admin buildings. There's a whole new neighborhood that's been set up. And so when you drive through, you don't really see it because now it's on the other side of the river. You kind of have to go down across the bridge. But
Okay.
significant amount of recovery work that's happening there. And then also know on the health side that Interior Health is actively engaging in their recovery process. So more information to come soon on what it looks like for the rebuild of the kind of hospital and health infrastructure there.
Yeah. We had a cabin in 100 Mile, and that drive up there was devastating, like over the years, because there was
Yeah.
another town, I think it's Ashcroft, got burned
Yeah.
out. And then even at 100 Mile, they had that massive fire there. And then I'll just tell you a story. When we were at our cabin, there was a fire across the lake, but the ash was falling like snow, so we just had to evacuate. And it is pretty scary, I have to tell people. And we were gonna leave our dog and go out for dinner, and then we thought, no, we just gotta go. That's it. Anyway,
Yeah.
thank you so much for sharing all of this.
For sure. And it is. It's scary. And I think no amount of preparation or no amount of kind of what we tell people, be prepared for wildfire season, really gets you ready to the extent where once your home is on evacuation alert or order, it's really a whole switch in your thinking. And so,
Yeah,
we certainly encourage people to be prepared, but also know that, it's going to be a little bit more of a crisis once it happens to you.
yeah, yeah. Thank you.
Yep. If anyone else has questions, feel free to ask. I do have a question if that's okay.
Yeah, go ahead, Mark.
In terms of the Indigenous communities that are affected by poor air quality, what are some of the biggest cultural things you're seeing that are affected by poor air quality, wildfire smoke, and how can we combat that?
Yeah, great question. And really, it's that access to the land as like the underscoring foundational piece of that. And
Yeah.
so, again, the foundational piece is if it's smoky out, if you can't go outside to gather medicines, to harvest traditional foods, to be on the land in the way that's reflective of your culture and your way of knowing, that not only has the health impacts of not accessing those wellness pieces, but also the psychosocial impacts of that disconnection from culture, from those ways of knowing. And then I think, and this is outside of my area expertise, but certainly I would suspect also impacts to the wildlife, to again those non-human relatives that might be within that traditional territory. So when you look at the whole landscape change of wildfire and wildfire smoke, we're seeing huge shifts in what have been a way of life and a way of knowing for 10,000 plus years.
Yeah, the complexities of that alone are enormous, enormous.
Absolutely. So yeah, so I'm, again, such a propagandist for climate mitigation because it isn't just the acuity of the wildfire itself, which obviously has tremendous and terrible impacts to communities, but it's what even a slowly changing climate can mean in terms of ways of life that have been practiced since time immemorial, and access to plants and animals that are moving north as climate shifts temperatures away from those traditional territories and into different areas.
Excellent. Thank you for that. Anyone else with any questions?
Hi.
Hi.
Hello.
I just wanted to say thanks for the presentation. And I also I really liked how you connected to the wood fire stoves as well and how prevalent that is and how connected that is also to the health of people. And I think that's really interesting work. And I think you're always like, I could tell you're doing work that intersects with so many other things, even if it's not just wildfire related. And I think that's really important to take that perspective. And yeah, I don't know if you have anything else to say about the wood fire stove or like what you would see that looking like moving forward. But I know it's complex, but yeah, I just was really interested by that fact. So thank you.
Yeah, and I would say that's even more of a challenge to address than wildfire smoke because it's people's primary heat source. And so even when you look at some of the initiatives that have happened in terms of there's like the wood fire appliance exchange program that a lot of communities offered. So you'd like turn in your kind of old wood burning appliance and would get a couple $1,000 discount on a new high efficiency one. I mean, the challenge there is one, they were pretty limited opportunities, and two, I don't know if you've priced out a wood stove lately. They're like 5 or 6 grand. So when you like give someone a $2,000 discount off that, sounds great until you realize they still have to come up with a few grand, and that's just not attainable for a ton of people, the majority of people, I'd say. And so I think there's other work that we can do as health system partners in terms of giving people like best practice on burning and how to make sure like the wood is appropriately seasoned. And but even with that, when we look at barriers to people's decision making if they don't have access to, well-seasoned firewood, if they don't have the gas money to go out and get it themselves or to buy it. We're really relying a lot on neighborly systems or community systems of providing them with that, which might not be attainable in every community. And people do what they need to do to stay warm during the winter months. So I think we can offer this kind of big menu of mitigation opportunities, but also acknowledging that the people who would most benefit from those mitigation opportunities are the ones who are most likely to be negatively impacted by the lack of those. So, yeah, in my perfect world, what I would love to see would be an investment from Indigenous Services Canada in terms of heating infrastructure in a way that moves beyond the kind of 1970s wood furnaces that we see in a lot of homes to something more sustainable, and that's not putting people with a $400 monthly hydro bill from a heat pump that might not even meet their efficiency needs during the coldest winter months. But until I get elected prime minister, that's not on the radar.
That was an excellent question. Thank you so much, Megan. That we did a little trip actually with the BC Lung Foundation, and that came up quite frequently in where was it? Dawson Creek.
Yeah.
Yep. And because those remote and rural communities are based around those wood stoves, wood heating systems, and like you said, it's so intricate. It's cultural, it's community, it's affordable. You can't just shove that away from someone and replace it with something that's going to cost more and be more inconvenient for them.
Absolutely. And as a personal anecdote, I grew up in rural BC. My parents still have wood burning appliance.
Yep.
And it took me 20 years of being in public health to finally convince them to invest in a high efficiency wood stove like 2 years ago. Like that's how kind of recent it took with me kind of, badgering them for years.
Yeah,
And they had the means to do so. So you can see what the barriers are for folks who,
exactly.
have neither the means nor the knowledge to know why that's important.
Yeah. Well, I love that. I mean, that is a long process. Like you said, it's going to take time, but the more we talk about it, hopefully, the more people are aware of it as well. Because you just don't
Absolutely.
get that in metropolitan areas, but it's everywhere outside of the Lower Mainland.
Yeah. Yeah, exactly. And it's not just as easy as saying, let's switch everyone over to heat pumps. We know that there's a ton of barriers that exist there. So, yeah, I think continued advocacy and continued conversations are how we move the needle.
Yeah. Excellent. Does anyone else have any questions?
I just say that when we had our cabin at 100 Mile, we had propane and electric. And you're right, they were both expensive because even when we weren't there, we left our electric on just low enough to keep so the house wouldn't freeze, and
You don't freeze the pipe. Yeah.
it just cost us $250 a month for just to leave that low electric on.
Yeah.
So it's really expensive, and I agree, it's a huge barrier for people who are living there.
Yeah.
The propane stove that we had, the heating stove was really efficient and just heated the whole place. So it was really great, but of course we weren't there to leave that on. So yeah, it's expensive. I agree.
Yeah. Well, and like you say, now with fuel prices increasing as
Yeah.
well, I mean, I think propane's over $1 a liter now, and it used to be 18, 19 cents. So
Yeah.
you look at that increase in cost for that as a fuel source too.
Yeah. And then we forget when we live in the Lower Mainland that the north is cold, it is 20 below. So you really need a heat source. And
Yep.
that's why people keep their wood stoves for so long.
You got it. Exactly.
It's like you said, I just don't believe they understand that, all those particles that they're breathing in that get into the air, those fine particles.
Yep. Yeah, and I mean the number of people you hear say, "I love the smell of wood smoke,"
Yeah.
without acknowledging like that smell is actually harming your lungs and I love the smell of wood smoke, but I'm also aware that it's not particularly good for you from a public health lens.
Yeah.
Yeah. Absolutely. Well, this has been wonderful. Thank you so much, Casey. And oh, we do have a question in the chat. Uh, with regard to the portable air cleaners, how do I obtain? That's an excellent question.
Great question. So once our program is up and running, which is usually when wildfire season starts, so the next, I mean, you could say we're already in wildfire season, but the next few weeks or month, FNHA will put some information out on our social media site. Each region has kind of their own pathway. I will share the intake for our interior region into the chat, so you have that, and it's just as easy as that.
Nice. Excellent. There we go.
Mark, for anyone who wants to build one, if I know that BC Lung has an excellent site with instructions on how to build one as well.
Mm-hmm.
Yeah.
Yes. And so does the SFU Breeze project, which Casey mentioned earlier.
Yes. Yeah.
Yeah.
Yeah, and they are fantastic. I think the work they're doing is brilliant.
Yeah.
It's easy, it's attainable, and their inclusion of the kind of knowledge translation in with that is just such a smart program.
Yeah.
Yeah. They've really made it accessible for everyone.
Yeah. So we're thrilled to partner with Anne-Marie and her team to
Yes.
get that messaging out as far and wide as we can.
Yeah, she's excellent. If anyone hasn't met Anne-Marie from SFU Breeze Project, she's quite a character, a lovely person. Well, that's fantastic. If anyone else has questions afterwards, feel free to either email us or you can email Casey. He's got his email up there in the chat.
And I've added Caitlin's as well. We don't want to forget her and her contribution to this work. And I know she's disappointed she couldn't be here, but hopefully I held up her end pretty well.
Absolutely, yeah. And we'll get her next time as well.
Absolutely.
Awesome. Well, thank you so much, Casey. And thank you, everyone, for joining us. This has been a wonderful day, and I hope you all learned a lot.
Thanks so much for having us. Cheers.
Bye-bye, everyone.